Hi, I am Benjamin Beyond from D Block. I'll be telling about my disease topic, and that is the Tay Sachs disease. The Tay Sachs disease, named after founders Maren Tay and Bernard Sachs, is a fatal genetic lipid disorder where harmful quantities of GM2, a fatty substance, build up in tissues and nerve cells in the brain. It's caused due to the lack of activity of an enzyme called beta-hexosaminidase A that makes reaction faster and biodegradation of gangliosides. There is also a mutation on the hexa gene of chromosome 15. The destruction of neurons in brain and spinal cord leads to a problem in the nervous system. Simply, people with the Tay Sachs lack one of the 40 types of the lysosomal enzyme. It has numerous of different names as shown. Some include TSD, GM2 gangliosides, hexosaminidase A deficiency. Speaking of inheritance, this disease is an autosomal recessive genetic disorder inherited from parent to child in which the child's brain and nervous system gradually deteriorates. It is not a sex chromosome disorder. It is rare due to the fact that it's recessive, not dominant. Both parents must carry the mutated genes in order to have an affected child. In this case, there is 25% chance with each pregnancy that the child will be affected with Tay Sachs disease. This can happen at any time in your life. Features include muscle weakness, ataxia, loss of muscle coordination, and problems in movement, speech, and mental illness. A common characteristic is an eye abnormality called a Terry response. As infants, they lose motor abilities like turning over, crawling, and sitting. As a child, you can be blind, deaf, or unable to swallow. Muscles begin to atrophy, and paralysis sets in. Other neurological symptoms are dementia, seizures, and other increased startle reflex to noise. Also, intellectual disability can occur. Most children with this can live only up to their childhood. Signs and symptoms show around 3 to 6 months in age. Tay Sachs is fatal and can kill you. The disease not only harms you internally and externally but damages the brain. Psychologically, you will have problems and neurons will continually get destroyed. It is one of the worst diseases to have. I would describe this disease to someone as fatal because it causes problems externally and internally. The inability to walk and think properly with muscle problems and paralysis followed by several other factors and aspects that will be unsuitable to the environment. It is physically limiting due to the paralysis and is life-threatening. Associated with the lysosomal enzymes, it causes too much of a fatty acid to build up in tissues and nerve cells of the brain. The build-up to toxic levels, thus destroying the nerve cells and causing mental and physical problems. Each year, 16 cases occur in the United States of America. However, in the Ashkenazi Jews, Central and Eastern European are higher at risk. 1 in 27 are carrier and 1 in 250 are. And in non-Jewish population like the French, Canadian, and the Cajun heritage, both parents are carriers. There is 50% of being a carrier, 25% of each having the disease or not having the disease. Unfortunately, there is no treatment for this disorder. There is gene therapy that will help minimally and make progress slow. While anticonvulsant medicine may initially control seizures, other supportive treatments include proper nutrition, hydration, and techniques to keep the area open. Children may eventually need a feeding tube. The respiratory care will help reduce the lung mucus accumulated that cause breathing problems. Assisting feedings devices that come handy due to the problems in swallowing. 2 types. Nasogastric tube insert nose to stomach or percutaneous esophagosgastroscopy (PEG) tube placed in the abdomen into the stomach with surgery and permanent. People can have physical therapy to stimulate muscles and joints such as physically moving the affected body parts. The purpose of the physical therapy is to help keep joints flexible and maintain as much as ability to move range of motion as possible. This can help to delay joint stiffness or contractures and reduce or delay the loss of function or the pain that can result from contractures. Parents can have a blood test to measure the hexosaminidase A activity to determine if they are genetic carriers. Couples who are expecting to get a child may do screening, successful to some families. There is a care to detect if individuals are carrying mutated gene and prenatal testing determine if fetus has inherited it. The enzyme assay detecting individuals with lower levels of hexosaminidase A approach tests the phenotype at the molecule level by measuring levels of enzyme activity, while the mutation analysis approach tests the genotype directly, seeing known genetic markers. As with all biomedical tests, both approaches produce some false positive and false negative results. Check your family pedigree to see if your family has a chance of Tay Sachs. A prenatal testing is effective by having both chronotic villus sampling CVS and amniocentesis present developmental risk to the fetus that have to be balanced with the possible benefits, especially in cases with the carrier status of only one parent is known. Choose the right mate and have a pre-implantation genetic diagnosis. It avoids termination in pregnant and free of disease under consideration. Helps but expensive. In the case of Michael, he had the symptoms and found out that he lacked one of the 40 lysosomal enzymes, swollen as well. He would die soon after inability of hearing and paralysis. There was a neurophysiological study. 20 children with proven Tay Sachs disease underwent neuropsychological investigations. Although the enzyme defect is demonstrable before birth, the electroencephalograms showed mild abnormalities during the first year of life, but rapid progressive deterioration thereafter until death, which usually occurred before the age of 4 years. The electroretinogram remained unaffected in keeping the function of retinal receptor elements, although some were affected. The combination of neurophysiological features and their evolution are of interest as they differ from those of other neurometabolic diseases of early childhood. Scientist Michael Kappa, Johns Hopkins University, developed and later automated an enzyme assay test for detecting heterozygous carriers. For the first time in medical history, it was possible to screen broadly for carriers for a genetic disease, and a physician or medical professional could counsel a family on strategies for prevention. This helped decrease Tay Sachs disease among families a lot. Meticulously planning and working, he developed the first mass screen programming for genetic disease carriers. Tay Sachs disease has become a model for the prevention of all genetic diseases. He was a public health model. These are used all over the place, helping families around the world.
In 2005, Sherry and Brian Manning were expecting their second child while their first son, Dylan, was battling Tay Sachs disease. What has your experience been with the progression of this disease with Dylan?
Difficult. Tay Sachs disease is a genetic disorder that's recessive, which means both parents must carry the defective gene. And what happens is the fatty acids build up around the central nervous system and take away all of his functions. We wanted to watch this little guy grow up.
Thank you, and hope you learned a lot about the Tay Sachs disease. Remember, risk is greater than you think.
Somewhere beyond the sea, somewhere waiting for me.